Hi, everyone. My name is Anna Aurelio. I am the VP of Campaigns for Economic Security Project Action, and we're really proud to partner with Doctors for America and Unrig Our Economy for today's event. This is part of Economic Security Project Action's Stop the Healthcare Heist Medicaid Day of Action, and we have 61 co-sponsor organizations and dozens of events across the country. 61, because that's how many years ago today President Lyndon Johnson signed Medicaid and Medicare into law. These two programs have been a lifeline for hundreds of millions of Americans. And yet, at a time when so many families are struggling just to put food on the table and keep the lights on, much less pay for healthcare, we should be strengthening that lifeline. And instead, last summer, Republicans in Congress gutted Medicaid to pay for tax breaks for billionaires and put the future of Medicare at risk. Earlier this week, despite promising not to touch Medicare, President Trump raised costs for millions of seniors under Medicare Part D. The impacts of these devastating cuts are already being felt across the country. For the families and folks who are joining us today and who we'll hear from, and perhaps even most keenly in the California Central Valley, where our own Economic Security California has organized families at an event today to call up Rep. David Valadeo's vote for these devastating cuts. I'm so pleased and honored that a longtime fighter for the public, whether it's a fairer tax code, child tax credits, or better health care, is here to kick us off. Senator Ron Wyden of Oregon. He's only able to join us for a short time, so if you have a question, please drop it in the Q&A during his remarks. Senator, over to you.
Anna, thanks so much. And this is incredibly important what you all are doing. And let me spare everybody the filibusters. First of all, a year ago, the Republicans took a wrecking ball to the American healthcare system with their budget, and all the breaks were the people at the top. I'm the ranking Democrat on the Finance Committee where we deal with taxes and the like, and it was clear the breaks were for the billionaires and people of modest means were going to fend for themselves. And if you wanted me to sum up the Republican approach, because much of it went to the Finance Committee, it looks to me like one big disenrollment program that is going to leave millions and millions of people worse off. And I'm particularly struck by the fact that millions of Americans are set to lose Medicaid coverage, not because they don't work, but because of new paperwork burdens and bureaucratic, red tape. And the Finance Committee staff here in the Senate has crunched some numbers for me with respect to Oregon alone. In my state, 27,000 fewer adults and children have Medicaid since Republicans passed their record-breaking cuts. Across the state, particularly in rural areas, doctors, clinics, and hospitals are feeling the financial squeeze. And I'm telling you, I just came from 6 town hall meetings at home in rural communities where Donald Trump won 70% of the vote, and those healthcare providers, particularly hospitals, are just trying to figure out how in the world they're going to keep their doors open with all these cuts. And of course, the Trump people misrepresented to Oregonians and everybody else what was really going on. This is the first time, and I've been focused on healthcare since my days with the Gray Panthers, I've never seen an administration saying, we're not going to give you the details until after the election. So when I was home a week or so ago, people were saying, Ron, just try to get us the facts so that we can try to get by. And some of the examples just take your breath away. And they really kind of lay out the fact that the Republicans are saying you've got to prove that you're sick enough to deserve health care. An example would be a person in the middle of a healthcare crisis or a course of cancer treatment will be forced to secure explicit attestations from their doctor linking their illness to their capacity to work. And so groups all over the country are trying to express a concern about having a more balanced kind of approach. The Republicans said that the Democrats weren't interested in fighting fraud. And I said, that's baloney. We took the GAO approach for what we're talking about and said the insurance brokers are ripping off the system. So we're interested in trying to make things better. And when millions of Americans are set to lose, Medicaid coverage, that is not making things better. I think you all wanted to ask a couple of quick questions, Anna, and why don't we go ahead and see if we can let people have that, and then I'll have to go off to the next stop.
Great. Senator Wyden's happy to answer questions. Folks want to put it in the chat. That would be great.
One other element real quickly before we go to questions. I'm in strong support of Oregon and the 24 other states who are suing the federal government to block some of these bizarre work requirements that are going to hurt so many people. And next month, I'm going to be holding field hearings across the state to hear from Oregonians about the real world consequences. I've had 1,100 town hall meetings, and I think it's one thing to talk about healthcare in the abstract and another thing to listen to folks at home.
Absolutely. Folks can use the Q&A function at the bottom of your screen to post questions for Senator Wyden. Okay, it looks like we have a question.
Somebody's being
Uh,
bashful, Anna.
sorry,
Someone is being bashful.
I do. Let's see. We've got a question about someone who is approved for hospital financial assistance and believes my child's visit was covered. Months later, I received a separate bill because the physician was employed by a different healthcare organization, even though the care felt like one visit. Um,
What what that's about is an increasingly common situation where healthcare providers are not telling people the facts and giving them real transparency about their healthcare choices. We're putting out something today from the Finance Committee Democrats saying that that's one of our top priorities to change next year is to make it clear to people what their healthcare choices are, give them more information so we don't have these kinds of tragedies that this person is bringing up in terms of saying that they thought they had X and they really didn't have X and Y didn't work for them. And now they're standing there trying to figure out how to pick up the pieces.
great. And it looks like
And I think there's another part of this that relates to the publication we're making today about our choices. I think that example is sort of exhibit A about why it's time to reimagine healthcare so it actually works for families. It sounds like in this case that the person described, it works really well for the companies and the insurance side of the house, but it doesn't work for patients and families. And so what I've tried to do in healthcare since my days with the Great Panthers is make it work for families.
excellent. We've got one last question for you, Senator from Laurel, asking, shouldn't Democrats make repeal of the big ugly bill a top priority for the midterms?
No question about it. That was not a hard call for me. And that's why I hope people will go to widen.senate.gov and see some of the things that we're laying out for the future. It's clear to me that the American people are completely disgusted with what the Trump healthcare program was all about. But we know citizens want to have specific ideas. I'll just give you one on that I'm working on, today. We saw that our effort to hold down insulin prices was a big deal in terms of trying to get people out of pocket help. Oh my goodness, there were so many conservatives. That's going to be price controls. It's going to be horrible. Right now, I'm working with grassroots healthcare groups to figure out what the next examples can be to follow the insulin, case to show that it's possible to reduce out-of-pocket costs for people and not have price controls or discourage investment or innovation and the like. So we want people to play offense because we're going to come out at the beginning of the year with a bold effort to repeal the Trump plan and take particularly the pieces that are so damaging to our citizens out.
Senator Wyden, thank you so much. Keep up the good fight. And I'm going to move us on to Senator Van Hollen.
Big
We're
thanks.
really, oh, sorry, go ahead.
Big thanks.
Thank you. Um, so we're so excited to hear now from Senator Chris Van Hollen. He is a champion of investing in working families and is leading the fight right now on how our country should prioritize people over profits. Senator Chris Van Hollen of Maryland, he's also equally busy. He'll have to leave us soon, so please drop questions in that Q&A function. Senator Van Hollen, thank you so much for being with us today.
Well, Anna, thank you, and thank the Economic Security Project for organizing this gathering, because it's really important that we shine a light on what's happening so that we can build momentum for reversing the damage that's been done. You had a question to Senator Wyden about the need to roll back the damage done in the so-called Big Beautiful Bill, and we need to do that. And in my view, we also need to take other measures to strengthen our healthcare system. So that's why it's so important that we're holding this discussion today. I want to thank all the people who are participating. I want to thank Jennifer and Rebecca and Tony. I understand we're going to hear sort of personal stories about the damaging impact of the Trump action on their situation and their healthcare. And you can't have economic security if you don't have healthcare security, and that's the bottom line. And I think on this 61st anniversary of the signing of Medicare and Medicaid, it's especially important that we hold people accountable for maintaining that promise, because that was a promise that was made. And unfortunately, when Republicans and Donald Trump passed the Big Beautiful Bill, they violated that promise. They tore up much of that promise. And it was a beautiful bill if you're a billionaire. Billionaires got big and permanent tax cuts, but they got that at the expense of everybody else, especially these big cuts to Medicaid. And later, the fact that Republicans refused to extend the premium tax credits under the Affordable Care Act. So it's really important to get the word out that they extended the tax cuts, the Trump tax cuts, for the billionaires and the richest people in the country. The one tax cut they allowed to lapse was the tax cut that allowed working people, middle-class people, to better afford their health care through the ACA. And so that was a direct hit at health affordability in America. And I can tell you that the impacts are going to be very strongly felt in my state of Maryland and across the country. So it's estimated that in Maryland, 200,000 people will lose health care because of the cuts to health care in that really big, ugly bill that they passed, and that 18,000 Marylanders have already dropped out of the ACA coverage entirely this year because of the dropping of the tax credits. They could no longer afford it. And then there are others who are having to downgrade their plans. And as a result of that, they will be paying higher premiums and higher copays. One word about the Medicaid cuts, because as Senator Wyden said, and as you'll hear, these essentially are being implemented by creating more bureaucracy and more red tape to prevent otherwise eligible people from securing the coverage that they desperately need. And in fact, they're going to catch up a lot of people who are working, but because of the hoops they have to jump through, will end up losing their coverage. And very cynically, this part of the so-called Big Beautiful Bill, the cuts to Medicaid, were timed to take place after the November election. They're timed to start next January. Why? Because the folks who voted for that know how unpopular it is, right? To take away access to health care, to help shut down rural hospitals. They know people don't like that. And so they created a ticking time bomb where the big explosion doesn't happen until after the election, after they can be held accountable. We all need to hold people accountable now as part of our effort to shine a light on what happened and build momentum for reversing the damage that's being done now and the even greater damage that will kick in beginning on January 1st. We are now, of course, engaged in what I believe is an illegal war in Iran, further driving up the costs that everybody's having to pay, cost of gas, cost of diesel, feeding rising costs in food and groceries. And of course, we've lost 18 American service members, hundreds injured, and thousands of civilians killed in the region. So the president's response to that, as well as to the cuts in healthcare, has been doesn't care about people's financial situation. That's what he said. So we need to make sure that everybody listening here and that all of you spread the word about what is happening so that we can begin to repair that damage going forward, and not just repair the damage, but actually, in my view, expand access to affordable health care even more to have a truly universal healthcare system going forward. So thank all of you who are part of this effort to spread the word so that we can do much better as a country.
Senator, I thank you a lot and appreciate all the work you're doing to do much better as a country. We did have a couple of questions if you have a minute to be able to
Sure.
answer them. Great. We have one from Kelly, and she asks, how does the latest Medicaid vote affecting senior Americans and their families?
Well, it impacts seniors in a number of ways. I mean, there are people who are dual eligible. They're on Medicare and Medicaid, and the costs for them in many instances are going to increase. It also, when it hits Medicaid, Medicaid is the largest single payer for nursing home care. And so when you squeeze Medicaid and funding for Medicaid, you also end up hitting people who are in nursing homes. And then finally, rural hospitals depend for their existence on Medicaid. And the reason we're seeing the closure of many Medicaid facilities and the anticipated closure of even more is because of these cuts. And of course, that directly impacts seniors and everybody else in those communities.
Yeah. I'll go next to a question from Laura, and as a reminder, folks can type questions into the Q&A. Laura asks, and I think you already answered this, but Senator, will you support single payer?
I do support single payer. I support Medicare for all, and pleased to be a co-sponsor of that bill. My view is that we need to stop tinkering with what is a broken system. The Affordable Care Act was a very important innovation. It filled a very important gap. What the Trump administration has shown us is that they can take these measures to undermine and sabotage the Affordable Care Act. And my view is that everybody should be able to have the benefit of Medicare for all. We pay 18% of our gross national product over everything we make on healthcare, and yet we're not seeing the kind of healthcare outcomes that we would expect. In fact, many of our peer countries in the healthcare space do much better than we do. And so my view is it's overdue to pass universal healthcare, single payer, and Medicare for all.
Thank you so much. One more quick question, I hope, from Debbie, because we know that Maryland is a beautiful state with many rural areas. She asked, what is being done to keep rural hospitals in poorer sections of the country from closing?
Right. This is an area where the so-called big, beautiful bill, which again is beautiful for billionaires, but really stinks for everybody else, really hurts rural communities because Medicaid is essential to the ability of rural clinics and hospitals to operate, to take care of the patients that come through their doors. And so these hits to Medicaid are also going to hit those hospitals, which is why we've already seen closures in many, many places, and expect to see more when these Medicaid cuts fully kick in January of next year. As I mentioned. So it's a direct hit to Medicaid and to rural areas. You may hear some on the Republican side say, well, they put together this fund specifically for rural hospitals. But the reality is that the amount of resources in that fund pales in comparison to what was available through Medicaid for rural hospitals and rural health clinics. So it was really an effort to create a Band-Aid when the wound was so big that it's going to really be harmful to folks in rural communities and across the country. And it's going to especially hit rural hospitals and clinics.
Yeah. Senator, we really appreciate your time. Thanks for all you're doing, and thank you for giving us the perspective from inside of Congress.
Thank you.
So really appreciate all
Thanks,
that you're
Anna.
doing. And we're going to move on to our storytellers. I wanted to just build on the perspective that we got from both senators, the view from inside of Congress, and also to start stepping back and saying, you know, the Republican lawmakers who voted for H.R. 1 made a terrible choice. They cut our health care to fund tax breaks for billionaires and big corporations. But by and large, they will not have to suffer the consequences of their decision. They won't have to jump through hoops every few months to prove they're too sick to work. They won't have to fear losing their care if they can't prove it. They won't have to worry that one hospital visit could break the bank for their whole family. So now we're going to hear from just a few of the millions of Americans who will have to bear the pain of Republican Medicaid cuts. And we'll call on lawmakers who voted for the big ugly bill to listen, to look them in the eye, not only reverse these terrible cuts, but start working for guaranteed affordable health care. All of the following speakers will go back to back. We will leave time for Q&A at the end of the call, but feel free to type questions as you have been in the Q&A box as folks are speaking, and stay till the end. And we will start, we're so pleased to be joined by Jennifer Graham Partika. She has been an emergency room nurse in Scranton, Pennsylvania for 30 years, and her son relies on Medicaid. Welcome, Jennifer.
Hello, welcome. Thank you very much. My name, first of all, thank you guys for being here. Thank you for caring so much about the people who live in our communities and this topic that affects everyone who lives in them. My name is Jen Graham Partika. I am a master's prepared, board certified registered nurse serving my community in Northeastern Pennsylvania here for over 30 years. During that time, I've raised 3 kids who are now grown and flown and on their own. I'm also a local elected small fish in a small pond and kind of a big mouth advocate for the people I serve in both of those roles. My youngest son, who was a colicky baby, went on to have a lifetime of GI issues and was finally diagnosed with Crohn's disease several months just after he turned 26, which is an age where he kind of aged off of my own health insurance. He was terribly sick when he was diagnosed. He was skin on bone with a BMI of 17, and he was severely anemic from the blood he was losing every day. The biologic chemotherapy treatments he began receiving changed his life dramatically, and he will remain on these treatments every 8 weeks for the rest of his life. These treatments keep him just healthy enough to live his life and to go to work every day. And as soon as he felt better, that's just what he did. He works for a small local nonprofit which does not provide their employees health insurance. Many people with illnesses work in similar roles for small businesses who do not provide health insurance, and those people receive Medicaid. My son's finances are reviewed frequently to make sure he still qualifies. And I just want to counter, the idea that waste, fraud, and abuse is like a thing. It simply does not exist on the patient's side. Anyone suggesting otherwise is lying to you and spreading disinformation about this population. My son receives medically necessary life-saving support for a fatal illness and serves our Northeastern Pennsylvania community in a job he loves. Many people on Medicaid simply do not receive health insurance from their jobs, and the rest are severely disabled. They're in nursing homes, or they are children. Since these out of touch, poorly informed folks that we pay to represent our best interests in Washington have targeted Medicaid, let me also explain that Medicaid is among the top 5 payers for most hospitals in the United States. A well-funded Medicaid keeps all of us safe. Hospitals will not stay open if you cut their funding sources. They will close. Can you imagine Pennsylvania with fewer hospitals, with fewer acute care beds? Have you all seen an episode of The Pit? Do you understand that the community needs access to acute care hospital beds to keep them safe, the same way we need police and firefighters? It's all the same kind of safety net that keeps all of us safe. Can you imagine what our already crowded emergency rooms will look like if our communities lose even more access to primary care and preventative care that keeps patients out of the hospital? I have been a nurse long enough to confidently assert that all of our failures as a society end up in an ER. Our hospital systems are already stressed to the max. Changes in a chronically ill patient's access to primary care because they lack insurance will destroy our healthcare systems, which for many reasons at this point are like hanging on by a thread. Republicans say that the only people who will be affected by these cuts to Medicaid are those abusing the system, and this is not the truth. They are rigging the system to help their buddies who don't want to pay taxes like the rest of us do. The only way Republicans can afford those tax cuts for their billionaire buddies will be to hurt people who are already hurting. Billionaires who want for nothing are their priority. We cannot afford for anyone's care to get worse, for anyone's access to care to get worse. Your friends in healthcare understand better than most that we are all human and our bodies will fail. Everyone will need care. It's one of the things that should unite us. We need to refocus these conversations. Good government serves its people. We don't work and pay taxes to pay the salaries of reps who are actively taking things away from us, to lie to our faces as they take things away from us. We pay taxes to our government to provide services our communities need, services we will all someday need. Services, I apologize. Whenever I talk about this, I always remind anyone who will listen that we are all one bad day away from becoming someone who requires help. I have seen it far too often in my 30-year career. The disabled population is the only one any one of us can join at any time. If you are someone who can't be inspired to care about others, because they exist, consider programs like these as your own personal safety net. Everyone benefits when we care about the safety of our community. Thank you again.
Jennifer, thank you so much for joining us and for giving both the health professional perspective and the mom perspective, because we all want our families to thrive. I'm going to turn it over now to Dr. Krina Patel. She's with Doctors for America, and Dr. Patel is a primary care physician in Atlanta, Georgia, formerly worked at a federally qualified healthcare center, which depends on Medicaid funds to deliver care to underserved communities. Dr. Patel, you're next.
Good afternoon, and thank you so much for the opportunity to be here today. My name is Dr. Krina Patel. I'm a primary care physician in Atlanta, Georgia, which means I care for everybody and anybody who walks through my door. I'm proud to represent Doctors for America, a national organization of physicians and healthcare professionals working to protect and expand access to high-quality healthcare for all patients. As a primary care physician, I have seen firsthand what Medicaid means to my patients. Last year, I met a 34-year-old mother of 5 who had been dealing with high blood pressure for the last 10 years since her first pregnancy. She knew it was important to take her blood pressure medications, but she often had to go without them because sometimes her Medicaid would get cut off, as she would tell me, and then other times it would get cut back on. I met her last year when it was cut back on after a year without health insurance. I restarted her on her blood pressure medications and checked routine blood work. The next day, I had to call her and tell her that her kidneys were failing and she had to go to the emergency room. They started her on emergency dialysis, and now she goes to hemodialysis 3 times a week because her kidneys will never work again. This was an entirely preventable outcome. Her kidneys failed by damage caused by years of uncontrolled high blood pressure. If she had just been able to see a doctor and get her medications with regularity, this wouldn't have happened. But because her access to Medicaid was inconsistent and administrative hoops and hurdles made her lose her Medicaid and then have to jump through them to get back on, she ended up being permanently tied to a dialysis machine as a mom of 5 children. I wish this was an uncommon story, but I have so many more patients who have suffered unnecessarily because of issues with Medicaid access. And with these cuts, stories like this will become even more common. When Medicaid funding is cut, the impact doesn't just stay on paper or fill our budget as a nation. It actually shows up in exam rooms, emergency departments, and communities. More patients will lose access to their necessary healthcare and will only seek attention when things are too late, like it was with my patient. Emergency rooms, hospitals, doctors, nurses, everyone will still care for these patients. We don't care whether you have insurance or not. You are a human in front of us. They don't have insurance, which means the care goes uncompensated, and it already stretches our rundown, thin safety net hospital systems, which is especially critical in rural areas, which tend to serve a high Medicaid population. And when a rural hospital closes because it can no longer afford to keep seeing patients, the whole community feels that, not only through the loss of healthcare, but through the loss of vital jobs and economic hubs that come with a hospital. Medicaid is essential to keeping millions of Americans and their communities healthy. It is a vital lifeline that ensures access to healthcare when people most need it. The Medicaid cuts will destabilize this critical safety net and put our already vulnerable patients at risk. Specifically, the proposed medical frailty provisions are cruel and narrow and will require patients to prove that they are both medically frail and frail enough to not meet the work requirements because of their medical condition. Physicians and patients already have to jump through hoops, and we're going to have to jump through even more to prove that our patients are sick enough to deserve their care. This idea that patients who are already struggling and ill should have to prove their worthiness to receive care is deeply troubling to me as someone whose job has first and foremost always been to care for the person in front of me. I don't care who you are, what you look like, how you voted, you are a human and you deserve care. And now that is going to be cut from so many of my patients. Medicaid is not just an insurance program, it is the foundation that allows millions of Americans to receive care when they need it the most. Protecting Medicaid means protecting patients, healthcare workers, and entire communities. And I hope that policymakers remember this and remember the people that they are hurting when they pass harmful policies like these Medicaid cuts. Thank you.
Thank you so much, Dr. Patel, for reminding us that when healthcare gets cut, people get sicker. And in fact, we've delivered a common message in this campaign, which is under the HR1 bill, billionaires got richer and Americans got sicker. So I'm grateful for you for sharing this story, even though it's terribly sad. Thank you so much. And next we are joined by Tony. Tony's an Idaho community leader and organizer whose son depends on Medicaid home care services. Welcome, Tony.
Thank you, and thank you for having me, and thanks to the rest of the speakers. My name is Tony Belknap-Brinegar, and I live in southwestern Idaho next to the Snake River and the Oregon border. I have 3 adult children, and my oldest child, Anton, is the light of my life. One of the things that I dreamed about growing up was to be a mother. And so almost 27 years ago, that dream was becoming a reality. And I was so excited, and my husband was so excited. And one thing that nobody prepares you for is if something goes wrong, and something went very wrong when he was born. He ended up having a brain hemorrhage. He needed immediate brain surgery. He died on the table, was brought back, and then spent the first 30 days of his life in a newborn intensive care unit. When it was all said and done, a year later, and he had a MRI, his brain was mush, and he was missing the entire left frontal lobe of his brain. What the medical professionals could tell me was they didn't have any idea what he would do when he grew up. All we knew was that it was going to be a long road. And so my husband and I looked at each other and we decided that we were going to love this man to health. And that's exactly what we've done. But we couldn't have done it without Medicaid. Medicaid has been the backbone of his life. It has gotten him medication, life-saving medication for the seizure disorder that he has, care, in-home care, so that I could have a break, so that he could have a break, and for him to be able to do things like go to physical therapy, to get massage when he needed it. Anton brings so much joy to so many people, even though he has disabilities. He doesn't talk like you and I. He doesn't walk like you and I. And yet, when he was a junior in high school, we received a letter from another student who was helping him in one of his classes. And she said that he was the reason why she didn't take her life. He had inspired her. And people with disabilities just want to do everything that everybody else does. They just need a little bit more help. And Medicaid is the only option for him in order to receive home and community-based services. And the big ugly bill that was passed each state had to decide to pass the cuts or not. Idaho, one of the first things they did this past legislative session was to pass the cuts. So Idahoan millionaires are going to get cuts. And then they proceeded to cut $21.8 million out of a residential habilitation service for Idaho Medicaid, and allowing people with disabilities to not receive the services that they need. Like I said earlier, Anton is 27 years old. I have been caring for him for 27 years. My body is breaking down. I'm getting older. My husband's on the backside of 60. He will need care for the rest of his life, and residential habilitation is a logical service for him to move into. With this $21.8 million cut and service providers deciding this isn't worth it, I'm afraid of what's going to happen to him. In June, the Department of Justice has eroded the 1999 Olmstead Act, saying they don't think that people with disabilities should live in their communities, that perhaps they should just go ahead and live in institutions. If you want to see how what happens to individuals with disabilities in institutions, Google Willowbrook. That's what happens to people. So what I want to extrapolate a little bit on what Senator Van Hollen said, in that Medicare only pays for 30 days of care in a facility. The rest is Medicaid. Medicaid is the only option for individuals to receive care within their home. And again, what Jennifer said is true. If you live long enough, you will be a person that has a disability. You'll have hearing loss or vision loss. So this is a problem for all of us. And what we need today is a collective ask, an ask that healthcare is a right, and that's what we believe in. And we need to reinstate all of the cuts that were made so that all of us can live and thrive in the United States. Thank you.
Thanks so much, Tony. Your words are so important, and especially to folks who rely on home health care. Finally, we're going to be joined by Professor Dan Skinner with Doctors for America. Professor Skinner is a professor of health policy at Ohio University Heritage College of Osteopathic Medicine and editor-in-chief of World Medical and Health Policy. He will tell us about how this bill threatens the future of Medicare. And then after Dan, we will open it up for Q&A. So take it away, Dan.
Thanks very much. Thanks for having me today, and greetings from Central Ohio. It's my honor to provide just a bit of context on the Medicare piece of this. We've already talked about how intertwined they are, Medicare and Medicaid, and I can point back to some of the fantastic panelists that preceded me. Hopefully this all will be designed to encourage people to act as well, and that's the piece that needs to happen from this. This year, as we celebrate the 250th birthday of the United States, the anniversary of Medicare takes on special meaning, I think. In the 21st century, a country can't be great without great health care, and Medicare is a foundation of our country's health care system, and in cutting it, I think Republicans are really playing with fire in a number of ways. For nearly 60 years, for nearly 61 years today, Medicare has provided health care security to older Americans and people with disabilities. It's allowed millions of people to see a doctor, go to the hospital, get their prescriptions, and receive preventive care without having to choose between getting the care they need and being able to afford to live. It's been a lifeline. Medicare is more about more than healthcare. It's a foundation of really a social contract, and I think that's the piece on the birthday here of Medicare we need to come back to appreciating. I think you can judge a country, at least in part, by how it treats its seniors. Medicare is one of the ways we tell older Americans we see you, we value you, and we recognize what you've contributed to this country. It's a promise to younger Americans, and I don't think we talk about this enough. One day, and as we've talked about here, probably sooner than you think, young people, you'll be the ones relying on this program. And our promise is to say we will value your contributions and your humanity as well. Okay. So we can't forget, historically, And I encourage people to take some time to read this history. It's an important part of who we are. Medicare was one of the great poverty reduction programs in American history. It fundamentally changed what it means to grow old in the U.S. Right now, then, so aside from the wonky and policy questions, and there are a lot of them, there are a lot of high stakes things we need to talk about. We should be asking not just what do we think of Medicare, but what kind of country do we want to be? And I think it's a big question. It's an important question. The threats we're seeing right now, though, are sending the wrong message, right? The opposite message, the so-called, and we've talked about it enough, the one big beautiful bill. My colleagues have done a good job here talking about this, and the senators as well. It cuts hundreds of billions of dollars from Medicare spending, right? And there's nothing beautiful about it. It's really a catastrophe. It's really a catastrophe for the foundation of care for millions of Americans. At a time when the cost of living puts enormous pressure on American families and it's hitting seniors living on fixed incomes especially hard, we should be strengthening Medicare, not weakening it. During this ongoing affordability crisis, which I know the president likes to say this is a Democratic hoax, this word affordability, I think people are hearing that with the right ears that they should be, if that's how he thinks about this. We should be making healthcare more affordable, not shifting more costs onto the people who can least afford them. So we need more affordability talk, not less, and that's wrapped up in this conversation. This damaging bill is going to reduce payments to healthcare providers, strain local medical facilities, and potentially make it harder for patients to access care. It also hastens instead of addressing looming problems in Medicare's future sustainability. Republicans love to talk about, oh, Medicare, it's unsustainable. Well, this is their opportunity when they control government to fix that. And instead, they're choosing to go the opposite direction. And that can't be forgotten in this. It needs to be highlighted, in fact. This damaging bill is going to reduce payments to healthcare providers, yes, but we're also, we're learning just yesterday, right, that the Trump administration is going to be ending a Biden-era program that limited the cost of monthly premiums for Medicare drug coverage, right? This is a huge, huge hit on seniors, right? This is just the latest sign that the administration's not only taking seriously the affordability crisis that seniors are facing, but is actively contributing to it, is making policy decisions that instead of making things a little bit easier for folks, are actually going to make them more difficult. So when we cut payments to healthcare providers, we shouldn't pretend there are no consequences. These cuts put pressure on hospitals, physicians, and local healthcare facilities, particularly in rural and underserved communities like the ones we heard about today. They can make it harder to recruit healthcare workers itself at a time when we talk about workforce shortages. And ultimately, this is going to make it harder for patients to get the care they need, which is one of the things that we talk about a lot at Doctors for America. So let's be clear. Medicare is not just a line item in the federal budget. It's part of the healthcare infrastructure of the country. It's doctors, it's nurses, it's hospitals, it's clinics, and it's the ability of a community to keep its local healthcare system functioning and open. When Medicare is weakened, the consequences don't stop at the Medicare card. They ripple through families and communities, and we could talk more about what that means. So the question isn't just how much does Medicare cost, but it's what is it worth to us, right? To prevent illness, to allow older Americans to age with dignity, or to give some families some security when a parent or grandparent gets sick. So as we mark Medicare's anniversary, we should celebrate what the program has accomplished. We should think about its history and its trajectory, but we should also recognize what's at stake. I just want to encourage everybody to recommit ourselves to a simple idea that in a country as wealthy and powerful as the U.S., seniors deserve health care worthy of the contributions they've made to this country. It's a real way to pay respect, but also to do the right thing to our fellow Americans. And it's not too much to ask. In fact, I think it's the least we can do. And thanks very much. I look forward to the conversation ahead.
Thank you so much, Professor Skinner. Before we turn it over to Q&A, and we've got a lot of good questions teed up, I want to mention that we did have another speaker scheduled to speak, Rebecca from Wisconsin, who has a breast cancer diagnosis and relies on Medicaid to get through that battle. Rebecca needed to see a doctor today, so we're incredibly grateful that she's been able to get the care she needs today, but she won't be joining us. She is available for interviews, so please reach out to us after this call. if you're interested in speaking to her. So we'll open up the Q&A once again, and I think I'm going to go straight to a question for Dan, for Professor Skinner, from Jasmine. If cuts to Medicare could negatively affect patients, shouldn't we also be asking whether Medicare itself needs modernization? It was created in 1965, and our understanding of health equity, transparency, and patient-centered care has evolved significantly since then. How can we protect access while also restructuring the system to better serve today's patients?
Yeah. Thank you so much, Jasmine. Yes, of course. I mean, one of the we talked before when somebody asked Senator Van Hollen about Medicare for all or a single payer. It's a little bit of a misnomer, and one of the things that we need to talk more about is that Medicare for all, as conceptualized by those who are advancing these bills that we have, is not just Medicare as we know it today, extended to everybody. It's a thoroughly modernized, revised program, and I think we need to think about how to talk about that more seriously, because while Medicare does poll extremely well, you've asked most people, they're really, really happy there is a Medicare program, but they have their criticisms. There are lots of things we need to be talking about. There's a lot of discussion about technology and even the artificial intelligence piece and things we could do to be better with this. So for sure, we're not just talking about saving a 1965 program. In fact, one of the things that I focus with my students on is just policies get passed and then they need to be revised. They need to be refreshed. And Medicare has been. It's been modernized many times. It's not the same program in 1965, but we need to constantly do better with that. I think the thing I'll just emphasize is that cynical approach that you see from Republicans today who are offering these damaging bills, like the big beautiful bill, is that they're doing the opposite. They're not modernizing and fixing. They're eroding. They're going back to what Ronald Reagan was talking about in the early 60s, which is getting rid of Medicare. That's still the goal. And it's still the goal to get rid of Medicaid as we know it. And we need to keep that in mind and not get too lost in the details that there is an existential threat here that needs to be front and center.
Yep, great. A few folks in our questions and answers have mentioned how they're struggling with surprise bills, high costs, and all the bureaucratic burdens associated with just trying to access the care they need. What do we need to do to put patients before profits once and for all? And I'll answer for Economic Security Project, which is, of course, we need to reverse the cuts in the bad bill. And we need to fight for guaranteed affordable health care. But how do we improve our current healthcare system? And this is for any of the panelists, since you're on all sides of experiencing this. Jen.
I saw that question, and there are two things. Just having come to you from a background of hospital operations, I do at a much smaller scale want to point you to two resources that are available to you as you navigate hospital bills. The first is an estimate. You can go to your hospital and say, I'm going to have this done. Can I please have an estimate? And then they will honor it. And the second is a liaison or an advocate that you can call afterwards. So I hope that helps. I saw that a few of those questions wondered about that. You can also navigate that in the outpatient world as well. Those two resources will be available for you. But on a much bigger scale, I mean, I have to say the things that align most with my, I'm a member of the ANA. I believe in the dignity of every human being, like that is literally what guides me through my career and my practice. I don't know patients who have better insurance than my patients on Medicaid. I'm, people love to pick on, CMS administered healthcare policies, or plans, but I have to say I don't fight as hard when my patients have, CMS administered. And I'm sure Dr. and will echo that scenario. I don't feel. I think there's a reason our sickest people qualify for this care. And I really, when people push back about, we can't do that here, we can't do single payer, like I think Medicaid for all is fabulous. I would love to have Medicaid. I wouldn't want to have to live the life I have to live to get Medicaid, but I would love to have Medicaid.
Thank you so much. Dr. Patel?
Yeah, no, I completely echo what Jen, the sentiments she shared. And yes, the transparency does exist, but you really have to look for it. And I think part of the issue and part of the solution is like, we don't really have a healthcare system. We have a bunch of different players that all interact with each other, right? Your hospital system, your insurance company, your pharmacy, and they all have this complex web of like interactions that even I don't understand. The beauty of a single payer system is it reduces or streamlines that administrative process. So you're not having to check with 3, 4, 5 different entities. How much is this going to cost? Have I met my deductible because I had this procedure at this other hospital? And does my new procedure, like, do they know that I met my deductible? It's not a system. Nothing talks to each other in the way that it should. And I think if we really, like, my pipe dream is we just need some kind of centralized payer so that all that information exists within a limited number of silos, because right now it's just there's way too many players in the game and they don't all talk to each other well. And that's why you get surprise bills from someone who you didn't even see, like the pathologist or whatever, and you're like, what is that? It's not transparent at all. And it's designed to be that way because they don't want people to question, because then when you question, they'll probably, bring the bill down, but most people don't question and then they get paid. So it's designed to be confusing and it's predatory, and something needs to change.
Tony, you got something to add?
I think I'm going to answer the next question, so I'll wait.
Well, go ahead and answer the question. Tell us what
Okay.
you
Well, I was just looking at the chat and people were asking about what to do now, right? And I am an only child and I'm very impatient. I think that the world should revolve around me at every turn. So working within systems change has been really difficult for me because I want change tomorrow and not next year or the next 3 years. So I think in this time where we are also used to immediate everything, immediate communication, immediate, our needs are being immediately met through DoorDash. We have to take a step back and say, this is a system, and systems move very, very slowly. So the question of what can we do now is things that you don't want to hear, which is having to do the laborious work of communicating with your elected officials on the state, local, and national level, and do it and be the squeaky wheel. I've been the squeaky wheel, and it was shocking to me when I went to talk with one of our state legislators, who'd been a state legislator for a long time, and I'd emailed her and called her for about 2 or 3 years, and she never called me back. But when I saw her face to face, she goes, "Oh, you're the parent. You're the woman who has a son with a disability." And I was like, "Yep, that's me." And then she listened, right? So, but it took a long time and it took patience and it took being that squeaky wheel. So, unfortunately, I don't think we have immediate answers, but collectively, we can be the tsunami that changes the policies.
I wholeheartedly agree. And I know a lot of people are asking, what can we do? Community organizing and organizing is such hard work. And having the door slammed in your face is such hard work. And in the words of the great John Lewis, who used to come talk to us, then you go knock on the next door, right? So it is so important to get involved, get engaged, get your neighbors, get your friends involved, be the squeaky wheel, don't give up, be relentless, and vote. At the end of the day, the reason we're all here and the reason why the American public does not believe that the one big beautiful bill is beautiful for them is because we've all collectively managed to speak truth to power and bring the receipts about what it actually means. And so that is the hard work that folks have to do. Do other folks have anything to add? Professor Skinner.
Yeah, just really quickly, Medicare and Medicaid came about through a political process, and we're talking about policy. Students come to my office all the time and they say, "Don't we know how to fix this or that?" And we know we have smart people. We have some of the best healthcare professionals in the world, some of the best thinkers and scientists and everything. This is a political problem, and we can't finish today without reminding ourselves that we are in a year of electoral consequence, and politicians need to be afraid of what the people are going to do in the ballot box. in November, and right now they're not. And some of them are, though. They're seeing it, and I think also with what they've done with this big beautiful bill, all this kind of stuff, they see the vulnerabilities there. We need to exploit those vulnerabilities and use this moment and not miss the moment. I think it's really, really important to think politically.
I want to end us on an up note question, perhaps, from Sydney, who asks, what words of advice or encouragement do you have for voters or constituents who may feel like no one is on their side or policy won't help them? Jen.
So I have received a lot of comfort. I've given myself a lot of comfort by, thinking globally and acting locally. So it's sounds like the least important thing in the whole world. But when you run for local offices, when you start to it sounds like such a waste of time. And it sounds like you can't make a difference. But I have to tell you, I go to bed every night knowing that I have done everything I know how to do in my community. And I think that that's the first place to start. I see, the comments in the chats this is how a lot of my patients feel. They feel like completely frustrated. What do I do now? You vote, you get involved in your local community, you talk to your local electeds. Very much like Tony, they might not pick up the phone right away, but you be persistent, because your stories are what matter. They should matter. If they don't matter, then you replace them. But they work for you. They're public servants, and they will serve the public in one way or another. So, I hope that helps. I definitely sense the frustration. And if somebody can connect me to Jasmine, I can help her advocate a little bit. But I think that you'll find that most people on this panel right now are looking to help. We're looking to find ways to connect with our communities and try to change some of the things that we can possibly change for patients, because we will all be a patient. It's just a matter of time. So thank you. Thanks for having us.
Thanks, Jen. Tony?
I hear this a lot, what difference will this make? And my immediate gut response is, what's the alternative? The alternative is to do nothing. And if I do nothing, then I am not helping my son. I'm not helping others like him. If I give up, then I'm not helping others. And that's exactly what the people in power right now want us to do, is to give up. And so my hope lies in that fact that I don't want to give up, and because that is the alternative that I just can't accept. And so I wish I had this secret sauce to give everybody the hope that they seek. But what I have found hopeful is finding others in my community that also are frustrated and want to fight. Facebook, I don't like to be on social media a lot, but Facebook has a lot of great groups that are local that you can join. Idaho has a progressive women's group that I joined, things like that. So at least there's solidarity in knowing that there's other people like me in my area who feel the same way. And that's kind of that one little spark that I can say, okay, I'm not alone.
Well, I'm going to wrap with those words. We're not alone. And we know that we have been pounding the message that this healthcare cuts means that Americans get sicker and billionaires get richer, and encourage folks to stay engaged. And thank you so much for coming and participating in this important conversation. Encourage folks to follow us. We'll post this video on our website, economicsecurity.us. Shortly after this, and also follow us on Instagram for more actions and future upcoming events. Thank you so much. Thank you, Tony. Thank you, Jen. Thank you, Professor Skinner. Thank you, Dr. Patel. We already thanked the senators for coming, and let's do everything we can. Republicans are on their heels. Folks know that this is a terrible thing that they've done, and if we stay engaged and stay loud, we can vote them out.